Okay.
Let's go ahead and pan around. Good evening. And my speech for today will be free health care for all. America is in a state of health care famine. There are many people in America who live with no health care at all. People should not have to choose between health care, medicine, or food. A lot of people make this choice every day. According to Bain, in 2007, the U.S. spent more than 15% of its GDP on healthcare costs. That's nearly double the United Kingdom. Affordable healthcare must be free to all because it will cut down on the stress that doctors have, the amount of people who are going without coverage, and also bad credit. As you can see here, I have listed out here. Canada and other countries have free healthcare systems. They just pay a higher tax rate. The first main reason healthcare must be free, it will turn or cut down the stress some doctors have. Stress caused by unpaid bills by patients with no coverage. This also will lead to less time at work, more family time, productive time outside of work. And as you can see, we have a stressed out doctor. They're human like we are. So they get stressed and they get tired and they also need rest. Canada doctors spend 35 hours on the job a week, whereas an American doctor spends about 70 hours a week. There's an ever-increasing amount of people with no health care providers. People in Canada have equal access to health care services regardless of their ability to pay. The system is funded through taxation. And in 2009, 47 million were without health care in the Americas. In Canada, patients have no restrictions on the doctors they choose as well, according to Wexler. And according to John Kirk, in Cuba, you can get things like adrenaline, dextrose, and antihistamine for free if you're a Cuban. But if you're a foreigner, it will cost you anywhere from $1.25, 75 cents, and I think the adrenaline also is 75 cents. Economical conditions also can cause people to go without health care or health care insurance and things of that nature. These economical conditions can be anything from a loss of a job, things like that, or doctor's visits are avoided because they can't afford it. You know, people might be better off paying their electric bill or paying their car note or paying their car insurance before they pay for health care. Finally, we have bad credit due to unpaid hospital bills. You know, when you go out and purchase a car, things of that nature, they check your credit. They run your credit to make sure you have A1 credit before they allow you to have a car. Some places, you even go try to get employed, the employer might check your credit prior to hiring you on the job. Unpaid hospital bills cause insurance premiums to go up for people who have coverage. And this causes bad credit as well. The healthcare system can wreck a middle class family. The physical wounds can be taken care of, but the physical or the financial wounds can be very detrimental as well. A $20 medical bill can cause a lot of point drops in credit score, even if paid off. And those point drops can be anywhere from 90 to 100 points on your credit. Some thinly covered people can get into a catastrophic car accident, bad accident on the job, bad accident at home, and this can really send their financial state into a spiral because they can't afford the medical bills. And if they do pay the medical bills, something's lacking at home. Then there's no coverage, or the bills are not getting paid, and they can eventually end up homeless, lose their car, their house, or their job. The other side of the argument with healthcare reform, some employees can lose their job. However, reform will reduce premium growth and create 250 to 400,000 jobs in the United States alone. In conclusion, Barack Obama is not the only president who has tried to do healthcare reform. President Clinton tried to do it in 1993. You had also had President Nixon, President Carter as well, and not to forget to mention President Truman. There are 44,230 people losing coverage each day. Their coverage in a week's time, and some people could lose, you have the estimate of 191,670,000 could lose their coverage each month. 2.3 million each year, which is stated by the Chains. Free healthcare would be ideal. It must first be for all ages and will help take control on preventative diseases. If healthcare is not attended to or addressed, the state of our nation would be in a lot of trouble. And that is my speech. Any questions?
I have one. As far as the taxation thing goes, you're saying if everybody pays a certain amount of taxes, healthcare should be free.
Yeah, in Canada, it's based on taxation. I know a lot of people heard that taxes are high in Canada, and the reason being because they have what we call, some people would call it a socialist system, but it's really a government system. The doctors in Canada work for the government. You might have one doctor that owns his own practice, but it's his practice, and he might have one receptionist. And she answers the phones, take the patients in. But like I said in my speech, they work less hours. They're less stressed. They don't have to run nobody down. Healthcare providers, they get their money from different insurance companies because it's paid for by the governmental system. And it's a lot easier. Like I said, preventative diseases are better taken care of and things of that nature. Anybody else?
Who would be infected by the healthcare?
Well, everybody's infected by healthcare because even if I don't have health insurance, but you do, if I go to the doctor or go to the emergency room and don't pay my bill, your premiums go up. Somebody has to eat that bill. And eventually, the doctors get tired of running around. They send you to credit agencies. They do these things of that nature. And then you have bad credit. And then the doctor turns around, and then he has to charge somebody for that. So therefore, it goes back to the healthcare provider, and then that's when they raise your premiums up. So you might go from paying $50 a month to $55 a month because the nation as a whole, a lot of people don't have the healthcare and they're not paying bills.
But isn't there some type of insurance on that? Don't the doctors have some type of insurance that'll actually pay them regardless if the person pays or not?
Yes, they do have that insurance, but it still causes your premium to go up because once again, it's a headache, it's a hassle. They have to go through all this paperwork. That's more money they have to pay out for somebody to run all of the processing and to send out notices, to send out bills and things of that nature saying how much you owe. And then they have to pay the collection agency to try to collect the money from you. And that is my speech. Thank you guys.